All right, let's dive into a really fascinating and honestly pretty intense biological story. We're going to talk about what happens when your body's own defense system, your immune system, makes a huge mistake, leading to a condition called type 1 diabetes. So here's a real head scratcher for you. How is it possible for your body's cells to be literally starving for energy when your blood is absolutely swimming in sugar, which is pure fuel? It sounds like a riddle, right? But it's not. It's the central paradox of type 1 diabetes, and we are about to unravel it together. So yeah, let's start right there with this paradox of starvation. Because for someone with type 1 diabetes, this isn't just some abstract idea. It's the metabolic reality they live with every single day. Okay, this slide breaks it down perfectly. The easiest way to think about this is to imagine insulin as a key. In a normal body, that insulin key fits into the lock on your cells. The door swings open and glucose, your energy, can rush right in. The cell is happy, it's fed, everything's great. But in type 1 diabetes, that key's gone. It's just missing. So the door to the cell stays locked. All that glucose is stuck outside in the bloodstream, and the cell, even though it's surrounded by fuel, is starved. So where did the key go? Well, that brings us to the root of the problem. You could call it the original sin of this disease. And it's so important to get this. This has nothing to do with diet or lifestyle choices. It's a case of mistaken identity, a devastating error made by the body's own security team. What we're talking about is an autoimmune response. It's basically a friendly fire incident on a microscopic level. For reasons scientists are still working hard to figure out, the immune system, the very thing that's supposed to protect you from germs and viruses, gets confused. It looks at these incredibly important insulin-producing cells in your pancreas, called beta cells, and thinks, hey, you're an enemy invader. And then it launches a full-scale attack to destroy them. And here's the thing, this doesn't happen all at once. It's a slow, quiet, methodical process. It all starts with that one mistake, that misidentification. Then, over months or sometimes even years, the immune system just keeps up its quiet assault, gradually taking out more and more of these beta cells. The body's ability to produce insulin drops lower and lower and lower until it finally hits a tipping point. And when that happens, there's just not enough insulin left to do its job. And that's when the disease really shows up. So the key is gone. The cells are screaming for energy. This leads to our next phase, the domino effect. The body sounds this false starvation alarm, which triggers this whole cascade of desperate and ultimately really destructive survival measures. And this is the truly tragic irony of the whole situation. The body is absolutely convinced it's starving. It's getting these frantic signals from its cells, even though the bloodstream is overloaded with sugar that it just can't use. And so, what does it do? It panics. It hits the big red button and activates its emergency protocols. The first desperate measure is, well, the body starts to cannibalize itself. It starts breaking down its own muscle tissue. See, since the muscles can't get any of that glucose fuel, they send out an SOS for an alternative. And the body obliges by literally tearing down muscle protein and converting it into a different kind of energy. This is exactly why unexplained weight loss and feeling weak are such classic signs of undiagnosed type 1 diabetes. At the exact same time, the body pulls another emergency lever. Now, insulin normally acts as the brakes on breaking down fat. It tells the body, hey, we're good on fuel, no need to burn our reserves. But with no insulin, it's like the brake lines have been cut. The body starts rapidly dismantling its fat stores, flooding the bloodstream with something called fatty acids. Now, this also causes rapid weight loss, but as we're about to see, it creates a way, way more dangerous problem. And this slide is where you can see how all that internal chaos starts to show up as symptoms on the outside. All that sugar stuck in the blood has to go somewhere, right? Your kidneys go into overdrive trying to flush it out, and in the process, they pull tons of water with it. That's why there's constant urination. Of course, that leads to severe dehydration, which makes you incredibly thirsty. And all the while, those starving cells are just screaming for food, making you feel intensely hungry. See? It all connects. Now, this brings us to the climax of this biological drama. Because when all these survival mechanisms are left unchecked, they push the body into a full-blown, life-threatening crisis. It's a state of metabolic collapse known as diabetic ketoacidosis, or DKA. So here's how that meltdown happens. Remember all those fatty acids that were flooding the liver?
The liver gets totally overwhelmed, and its response is to convert them into an emergency backup fuel called ketones. Now, in small amounts, ketones are actually okay, but in this situation, production goes into hyperdrive. And here's the absolute kicker. Ketones are acidic. As they build up in the blood faster than the body can clear them, they cause the blood's pH to drop, making it dangerously acidic. And that state, that is DKA. It is a toxic triple threat. You've got sky-high blood sugar, you've got extreme dehydration, and you've got acidic, poisonous blood. This is a 5-alarm medical emergency. People in DKA can get confused, feel nauseous, and their breath can even have a distinct, kind of fruity smell. If it's not treated right away, it can lead to a coma, and yes, even death.
But, and this is a really big but, this story has a resolution. It turns out we can stop this entire catastrophic cascade and reverse it with a single, incredibly elegant solution. It's all about restoring the system by simply replacing the one thing that's missing.
The solution isn't some complex chemical cocktail or a crazy procedure. It is simply giving the body back the key that it lost. It's replacing the insulin. The second that insulin is introduced back into the system, that whole terrible domino effect reverses. It's almost like magic. It immediately unlocks the cell doors, letting all that glucose finally get in, which brings blood sugar down. It slams the brakes on that out-of-control fat breakdown, which in turn stops the production of those acidic ketones. The body shifts out of that panicked, self-destruct mode and back into a normal, balanced state. So when doctors are looking for this problem, this is a number they're really watching. A fasting blood glucose level, that means no food for a while, of 126 milligrams per deciliter or higher, that's kind of the line in the sand. It's a huge red flag that the body's system for clearing sugar just isn't working right. You know, this quote here really just nails the entire story we've just gone through. The absence of insulin, that's the missing key. It forces that starvation state. That triggers the breakdown of fat and muscle, the production of ketones. The whole chain reaction is right there in that one powerful sentence. So it's amazing that we can replace the key and manage this whole process. But that leaves us with the ultimate question, doesn't it? What's the next frontier? Can we find a way to stop that friendly fire incident before it even starts? Can we somehow prevent the immune system from making that catastrophic mistake in the first place? That is the next chapter in this incredible story. Thanks so much for joining this Explain.